So recently it's been coming a lot uh, in several areas of my life through acupuncture, yoga, just visiting and having coffee with friends. There seems to be a lot of knee troubles going on. Initially, the question came from my aunt and uncle out in Saskatchewan and just sort of how to take care of the knees or how to work with things like patellar tracking issues, patellofemoral issues, runner's knee, jumper's knee. There's lots of different ways of talking about how the patella tracks or sits. It's supposed to go, so the apex of the patella, the point, goes down the midline of the tibia fibula in kind of the bones videos, goes through the ankle in the center, so between the two malleoli or bones. So medial malleolus, lateral malleolus, so down to the center, and actually line up with the space between your second and third toe. So right down the middle of the foot. What tends to happen is the knee tends to be too in, the knee tends to be too out. Sometimes we turn the foot out, and then the knee comes in. All of this puts stress on the joint. So in the joints video, we talk about how this is a hinge joint, and there's more detail there if you're interested. The kneecap or patella is meant to float in the middle of the tendon, so it just kind of sits inside and rides along it as the quads, the four muscles up here, converge to make one tendon, goes down, attaches to the lower bone, the tibia, and when these muscles pull, it pulls the leg or the lower leg foot up. So it needs to pull evenly. If one's pulling more than the other, usually a little more this way, the outside IT band-ish stuff gets really tight, the inside VMO-ish stuff doesn't get nearly as much action as it should. So this muscle needs to get a little bit stronger. Or ideally, these two are even. But in general, this one needs to open, this one needs to strengthen. So as long as your kneecaps are lined up, apex patella, middle of the ankle, middle of the foot, space between second and third toe, then all you need to simply do from here is smile, breathe, and stand up. And the knees should stay reasonably straight and stable. So if you watch here, I'm trying to keep them stable, balanced in the correct spot. What we tend to do is some amount of something like that. Don't want to do too much of that. It's causing some damage in through here and or irritation, which leads to damage. So keeping this space is really important because it's this inner line that we need to become more active. We want to engage it a little bit extra. So a simple way, give or take 2 pillows between your knees, and they don't need to be super rigid. You don't need anything super strong, something that squishes a little bit, just so you can feel that extra action going on inside of your leg. A little more energy. You need to crush the pillows together. Just basically, you want it to be so your kneecap is still in that alignment we talked about, but there's a little extra energy on the inside. If I relax too much, my knees splay out and the pillows start to slip a little bit. So I'm just holding the pillows in place, engaging that inner line, and then groaning counts because that's still breathing, holding the breath we don't want to do. So still counts, or smiling, laughing, talking would be good too. Let's make sure you can see those kneecaps. Like so. And or if you have knees that are sore, back that's sore, that full standing movement isn't really going to work for you, do it from a chair, you're a little bit higher, or just do it without liftoff. Fire the muscles, go through the sequence, just don't actually achieve liftoff. The muscles are still engaging, you're still firing this area, which is what needs to get stronger to keep your kneecap in place. Basically, as this one tightens and this one weakens, this pulls more, the kneecap slowly goes and follows the direction of the pull, and is no longer pointing where it should. It's now grinding, that crepitus, that creaking. Other issues start to show up in terms of discomfort, irritation, swelling. Basically, if you don't want to have bad knees, or you want your knees to be better than they are, or at least you want your knees to be as good as they are right now, this is something you need to do a lot of. There's some of us that actually need the opposite. That's usually a bit more of a hip issue, but still connects into the knees. And that's where we work this outside line. Ideally, you'd work both because they're both even. If you know you have a bit of an issue here, a physio or someone has told you that, then spend a little more time on this inside one. You might not even need to do this one. Some people don't. But to show it to be complete, we'll do both. So use something like a strap or a belt or a tie or something like that. And you want it tied up so you're a little bit inside of where you want to be, so when you pull out and you're actually, now I'm in alignment, I have to use these muscles to stay in alignment. So again, if I relax too much, things droop in and they're a little bit too inside now, so I have to actually pull against the strap a little bit. I'm not trying to tear it in half, it's just enough that There's a little bit of tension here, a little bit of spring, and I can feel it working. Probably up here in the hips, but you can at least feel it working. But again, knees stay stable and straight as you breathe and move and or talk. See, there's always a little bit of wobble, but doing my best. That balances the outside. Pillows, sometimes I'll use a deflated soccer ball or basketball or volleyball or whatever you have lying around. You can even use your fist. You just want to make sure you have that proper alignment. So we talked a little bit about it in the standing video about the alignment. Give or take 2 fists or so. The biggest thing is that the kneecap, especially the point, goes through the center of the tibia, center of the ankle, center of the foot, space between second and third toe, and stays there as best you can. You're just adding a little more action down the inside or a little more action along the outside with the belt. Do some sit and stands, and even if the full lift off isn't working for you, make sure you breathe, and just, so even sitting here, you can engage the muscles. Engage the muscles. If you see when I engage my muscles, my knees come in slightly because I have a tendency to go out like most people. So when I actually think about it, engage, make sure I weight in my feet and I'm thinking about standing, then things start to work. Little value, extra value of the core turns on a little bit. But this is something you can do driving in a car on a road trip, sitting and watching TV, sitting wherever you are, doing whatever you are, you can still work on it. Ideally, you'd have a little bit of conscious energy so they always stay in alignment, but as I think about other things, of course, they drift out slightly. So it's a practice. More on the insides, strengthens this muscle, keeps the kneecap in place, then the kneecap glides over where it's supposed to, rather than grinding and crunching and twisting and going all kinds of silly places. Good luck.